said it couldn't be done, and he and this whole group have done it. He's our leader. He's done a tremendous job. Eduardo Vega.
You're here right now. First thing I want you to do is I want you to give yourselves a big cheer and a big hand for coming out. For coming out for dignity, for coming out for an end to what we've experienced, to what people have been experiencing for years. Dehumanization, an end to unnecessary institutionalization, unemployment, incarceration. We, people with mental health conditions, stand out up to today as the only people which is still legitimate to discriminate against. And what do we say to that? No more! No more! No more! No more discrimination!
No more discrimination!
No more incarceration!
No more incarceration!
No more dehumanization!
No more dehumanization!
We will take our dignity back starting today. This is a course. It's a long path. I want to let everybody know. The destination dignity is not over there. And it's not, even if you walked all the way to the Washington Monument, is it? No. Our destination dignity lies far ahead. But today we are on a course. We are moving with focus, and we are moving as a community. Today we have with us providers, we have with us advocates, we have with us family members, and people who live with mental health conditions themselves, the clients, the people who have been experiencing so much shame, so much invisibility. You are in the front. We are in the front. Please help me. Today is just a beginning. We're gonna walk a quarter mile for dignity, but we've got many miles to go, and we're gonna need you every step of the way.
Yes.
No. Everybody here, the Copeland Center, the Campbell Center, Niaparas Mental Health America, hundreds of volunteer hours to bring you together to serve this mission. Thank you very much. We're going to have also, and you'll look and you'll find more about the Dignity Coalition, which is many organizations. A lot of those people are going to be here to speak. We're going to have representatives for them here to speak today. Please go to the website.
So we have a very special guest today, Monica Palacio from the Office of Human Rights. She's the director of the Office of Human Rights, and she is a very special person that cares about the disability community. She cares about making sure that people's rights are not trampled on in the district. She has a wonderful staff here as well. Elliot and Stephanie are in the crowd. Raise your hands, Elliot and Stephanie. Yeah. Okay, so Monica, please come up. Yes. Please.
Our office is charged with the enforcement of civil rights laws here in DC, and our local statutes are some of the most progressive in the country. So if you have a chance to check them out on our website, it's ohr.dc.gov. Please read up on our laws. I think they're a model for the nation. So please check them out. Like so many other marginalized communities, people affected by mental health conditions face stereotypes, stigma, isolation, and discrimination. In my office, we receive dozens of these complaints every year in the arenas of housing and employment. And our office is here to take those complaints and investigate them. So if you're from DC, I want you to know about that, and I want you to know that you can come forward and you're safe with us. We're working to end discrimination against people affected by mental health conditions, but this is a long road. As Edgardo mentioned, this is the beginning of a process, and I'm so proud to be among a crowd of pioneers today at this first annual march.
Thank you, everyone. I assume you can all hear me. Okay, I am the director of the National Mental Health Consumers Self-Help Clearinghouse until September 29th of this year because we didn't get our funding renewed, but that's another story. I want to thank the supporters for doing such a fabulous job, and thank everyone who is here today and for coming out, because it takes all of us. There's going to be a lot said here today about the rights of people with mental health conditions, and I'm one of them. So I'm always here to support my rights and others' rights. But I would like to focus specifically on two aspects of this march, and that is the unconscionable levels of incarceration of individuals with mental health conditions, and in fact of individuals without mental health conditions, and also to put an end to the criminalization of mental health conditions and substance use conditions. Now, you probably have all heard this statistic already, but I'll say it again. The United States has less than 5% of the world's population, but it has almost a quarter of the world's prisoners. That is outrageous. And more than half of them have a mental health problem, according to a recent report from the Bureau of Justice Statistics.
Really pleased to meet and bring up here Judge Ginger Wren, an amazing champion for systems care reform. Quite a fireball. Thank you, Judge, for coming all the way from Florida.
Yes. Before I begin, I want to take a point of privilege and introduce in the audience, everyone knows him, he is an icon, and that is Dr. Dan Fisher, my soul brother from the President's New Freedom Commission on Mental Health. And thank you for everything, Dan. You're an inspiration. Let's see if I can hold this. Hello? Hello. 1 second. Good afternoon. I am Judge Ginger Lerner Wren, pioneer of America's first mental health court, which is dedicated to the decriminalization of persons with mental illnesses. Thank you. A court which 15 years ago was the model for congressional legislation and signed into law by President Clinton. A court which has diverted more than 17,000 people arrested with mental disorders out of our local jail system, and a court which is grounded in dignity and the promotion of human rights.
It's great to be here, and I have two phrases. Seems to be a day of phrases. The first one is, we are the evidence. We are the evidence. Whenever they say, where is evidence-based practice, just step forward and say, it is us. Our recovery is the evidence. The other phrase is, nothing about us without us. We need to be everywhere. We need to raise our voices. We need to overcome the fear and the trepidation that the system has put in us. We need to speak up whenever decisions are made about us. Nothing about us without 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 us. That's the origin of our movement. We are a movement of people who have recovered and are recovering and haven't yet been labeled and realize that they have to recover from life in an industrial society.
Thank you for inviting me. We always have a lot of heat in D.C., but very rarely much fire. You're going to bring fire to D.C. Yes. I bring you greetings and best wishes from all county behavioral health directors throughout the U.S. We are all in with you, and we support your cause. Nothing is more important than the dignity of all people. The dignity of persons who are disabled is essential. For far, far too long, persons with mental illness has been treated as second-class citizens. You have been relegated to the shadows of our society. We say, no longer. The time has come for change. The time has come for change. We are in solidarity with you to bring you out of the shadows, to bring mental illness out of the shadows, to bring attention to the trauma that causes mental illness. We are in solidarity with you to bring you wellness and recovery, to bring you personal well-being, and to bring you a full life in the community. We are in solidarity with you to bring human dignity to all persons who suffer from mental illness.
What are we here for? Dignity. And we're here for dignity because individual dignity is the moral essence of every person, and no one can take that away from us. They may try to deny it, they may violate it, they may stigmatize us, and they may discriminate us, but they cannot take our dignity away from us, ever, so long as we hold on to faith and hope and speak out like we are today. Let's also remind anyone who discriminates against us that mental illness or mental health conditions or behavioral disorders, whatever we want to call them, do not discriminate. Mental illness can strike anyone at any time. It doesn't discriminate between Democrats and Republicans, between rich and poor, between men and women, and it does not discriminate based on race or ethnicity. We also have to remember that we are part of a broader civil rights movement that has always, throughout American history, found its strength in individual dignity and love for others. And it's a movement that is bigger and runs deeper than any one organization or any one individual. But every one of us has a story that is part of that movement.
You can't take away people's human rights as a means of healing. I think, again, we're here to represent that dignity is intertwined with self-determination and choice. And what your perspective is on your own journey is your perspective. Your path to recovery is your path, and you should always be honored in your decisions and choice. For me, my recovery wouldn't be possible without support, family, friends, and people who were surrounding me, never taking away the dignity that I would heal and grow, and that I knew what was best for me.
Right.
And that would come to my aid. There is no recovery of just an individual. Mental health challenges are the result of community mental health challenges. Mental and emotional wellness is rooted in the wellness of a community. And I just want to say that every time the media portrays a difficult challenge in the community and pins it on an individual, they're scapegoating us. Whenever something happens in our communities, because our communities aren't well.
Let me say that in addition to being the chief executive of the National Association of State Mental Health Program Directors, I'm a grandfather, and as a grandfather, that's probably my #1 role. One of the things I appreciate for all of you being out here in this effort is because I want my grandchildren to live in a different life than what many of you have. I come from a family with a history of mental illness. I want to make sure that my grandchildren have a different life and different opportunities if they end up with symptoms of mental illness. So I thank you for your efforts.
Thank you. And thank you for inviting us at the National Disability Rights Network. As you probably know, we represent the Protection and Advocacy for Individuals with Mental Illness, the PAMI program. The PAMI program has represented over 300,000 individuals with mental illness over the last 30 years of our existence. We're the ones who slogged through jails and prisons trying to get people with mental illness out of solitary confinement and better mental health services. We're in nursing homes where people with mental illness are being stuffed daily. We are in juvenile facilities. We're in psychiatric facilities. We are in schools where children with mental illness are being secluded, restrained, sometimes even killed, cruelly expelled and suspended. All of these things are the work that we do because we have the legal authority and access to those facilities.
What do we want? When do you want it? Now! Okay. So I am Cheryl Sharp. I'm the Senior Advisor for Trauma-Informed Services for the National Council for Behavioral Health. Thank you. The National Council's work is rooted in the belief that every human being should be treated with dignity and respect. We foster a commitment to make sure the most vulnerable in our communities have access to safe, high-quality care that allows people to live meaningful lives.
Listen closely to what people are saying, and I ask you to listen closely to what they are saying about this broad term
of dignity and what it consists of. And when we're marching, think about the elements of that dignity. You've heard again and again that it's not just dignity, it is the opportunity to live in the community, to participate in the community, to have a sense of inclusion and opportunity and engagement in the world around you, and not to be a throwaway. At the Temple Collaborative, we talk about community inclusion as an essential element of that dignity. It's as much of a challenge because people are saying they want to go to work or they want to go to school. Sometimes it's as simple as just wanting to be able to join a gym or join a religious congregation and participate in the life of that congregation. Sometimes it is as much of a challenge to simply get a sense of personhood back, and sometimes it's the heartbreaking challenge of trying to get custody back of your own children, and much more. But it is the elements of this dignity, it is the elements of being able to participate in the community that you've heard again and again. To get there, we're going to need massive changes in public policies and in community programs and in the practices that we're all engaged in. We need vast changes in federal, state, and local policies that offer us both a philosophical change, that it is community engagement we're interested in, and offer vast changes in funding so that people have the supports they need to be engaged successfully in community life.
Was there a time in your life, any time, where you felt you didn't belong, you were made to feel that you didn't belong, that you were made to feel that you were a burden on other people, and that you were inescapably and intolerably in emotional pain and felt trapped in that? Has anybody here felt that way? Yeah. Now, how many people here can say now that they belong? How many people here say now that they have a sense of worth and meaning? How many people here now say that they have a sense of direction? How many people can say that now? You all are the voices of suicide prevention. You are the folks that let us all know that suicide is preventable. So, you hear this phrase, 1 out of 5 Americans have a mental health condition? There's 320 million Americans. That means 64 million people have some form of mental health condition. There's about 400 of you over the course of the day. You're here to speak for 70, 80,000 people. And you've done that today. Someday, they said once here, I have a dream. I have a dream that 100,000 people will march down Fifth Avenue, past CNN, Fox News, NBC, ABC, CBS, and the next day, everyone will see us, everyone will understand the power of dignity.
The grindstone is all that you see. Once made of gold, not turned so cold. Your hands have forgotten your dreams. Do you even know? Do you even care? When did you drop the keys? The keys to your dreams, the music to your soul. Remember how you once sang to me. Songs were the keys to your life. Songs were the keys to your life.